All right, let's get started. Welcome everyone. Thank you for attending the Animal Issues Thematic Cluster's first interview in connection with the 2020 High Level Political Forum. Today, we will be interviewing a fellow AITC member, Dr. Jim Desmond. Jim is a wildlife veterinarian and one of the founders of the Liberia Chimpanzee Rescue and Protection, as well as a consultant for EcoHealth Alliance. So today we will be talking about preventing the next pandemic through animal welfare. Just a few notes on the format. The interview will last for 30 minutes. I have a set of prepared questions, but attendees can also submit questions. So if you want to submit a question, please use the chat feature in Zoom, and then during the last portion of the interview, I will select 2 or 3 questions to ask. So with that, let's get started. Thank you, Jim, for joining us today.
You're welcome. Happy to be here.
So my first question for you is, what does the COVID-19 pandemic have to do with animal welfare?
So there's, I think, several things related to animal welfare where we can talk about the specific coronavirus pandemic that's happening right now. So one thing is certainly with this disease, so most emerging diseases, so coronavirus or Ebola or MERS or even influenza, most of these diseases come from animals, 70%, and then 70% of those diseases that come from animals come from wildlife. And so certainly there's the issue, there's certain interfaces that happen when people are either harvesting wildlife from the wild, or if people are farming wildlife and then sending them to markets. Either wild animals are taken from their natural habitat and then brought to a market, or in certain areas of the world, people are actually farming wildlife and then bringing them to markets. In any of these situations, obviously, it's not beneficial to the animal. So I think from an animal welfare perspective, certainly the end point where animals are being sold, they're kept in cages, they're not being fed properly, they're not being cared for properly, they're stressed. And so in that situation where you find live wild animals out of their natural habitat, put in cages, and then put in a place where they're not getting good care, that leads to stress, and then with stress, suppression of the immune system, and then that can lead to disease being shed by those animals. So some of the diseases might not even affect the animal negatively, but when they're in this mixed state where they're around other animals that they don't necessarily come in contact with, then they could be shedding virus like coronavirus or one of these other viruses, and then giving it to other wild animals in close proximity to them. And so that's sort of like an incubator for disease. And those situations are really scary from a public health perspective, and from the risk of spillover events like the current coronavirus that's become a global pandemic.
Okay. Is the wildlife trade the main pathway by which zoonotic diseases transmit to humans, or are there other practices that are high risk in that regard?
So I think when we think about the different pathways, the different ways that these diseases can jump from wild animals or domestic animals into humans, certainly wildlife trade is one. If you think about the whole sort of what we talk about as value chains, where you think about the value chain of, there's a hunter, he goes out into the forest, he kills or collects an animal, or he has snares set, and he takes the animal, and then he might kill it on the spot and then do something that way, or he might bring it to the market. So he might sell it to a middleman, and then the middleman collects animals. It might get sold to a farm. So there's a whole chain of events that could happen. So different people along that chain where there's a human wildlife disease, human wildlife interface where disease could go from the animal to a human. So that's one thing. So there's all different scenarios that can play out through that value chain. And the other thing is other human behaviors where people are manipulating their environment. So like you think about deforestation or agribusiness or the timber industry, certain the businesses, industries, or even just small like slash and burn agriculture, where people are impacting their environment and then they're affecting an ecosystem where obviously there's many different species of animals living. When animals are displaced from a certain area, then they have to find a new place. And so it causes stress to the animal. They're looking for a new place to live, and then they're coming into contact with communities where maybe they haven't been in contact with before. And so that can lead to, aside from the hunting and the whole value chain of the wildlife trade, there's the whole other human behavior thing where people can be affected, and people surrounding these different communities near the forest can be affected, and it can then cause disease that way.
Okay, can domestic animals be vectors for zoonotic diseases?
Yes, definitely. And so when you think about the human behavior in domestic animal production, of course, like the first thing that comes to mind is factory farming in sort of industrialized nations where animals are it's completely unnatural way for animals to live. So if you think about either with poultry farming, where many chickens are maybe crammed into a small cage, those animals are under stress, they're on cages on top of one another. So all of those situations related to factory farming leads to animals under stress, which can make them more susceptible to disease, and more disease being spread between animals within that setting, which then the animal workers, the people who work at those farms, can then be exposed to the diseases that the animals might be passing between each other. And then another factor related to industrial agriculture and factory farming is sort of the overuse of antibiotics. To prevent disease within the business's animal population, of course, they're using medicine to treat diseases or to keep those animals from getting sick. And in many cases, they're actually using antibiotics to increase the weight gain of certain species of animals, like with cattle, for instance. So that poses a completely different kind of emerging disease risk. So I don't want to get too off topic here, but in addition to emerging infectious diseases like coronavirus or like Ebola or SARS, there's a whole nother concern in the public health community about antibiotic resistance. So antimicrobial resistance develops in people who are overusing antibiotics, but then also in animals where there's a huge overuse of antibiotics for both preventing disease in industrially managed animals, but also to have them gain weight or have other effects on the animals to make it a better product. So for those two reasons, the use of antibiotics, for whatever the reason is, the overuse of that within animal populations can then lead to disease outbreak. And so it's just the whole business of factory farming and large industrial agriculture creates a really terrible situation from a public health perspective, but certainly for the animals themselves. I mean, those are terrible conditions for the animals to be living in.
Mm-hmm. And what's the latest on dogs and cats getting COVID? Is that a genuine risk, or has that been debunked?
No, cats can definitely get it. I haven't read any of the new research on dogs. So just to take a step back, I mean, in the early days of this disease outbreak, there's a lot of talk about, oh, well, the coronavirus is just, it's just the common cold. Well, there are a whole huge diversity of coronaviruses. This is just one, the one that's sort of spread around the world. And there's coronaviruses, the coronaviruses that infect dogs that don't infect people at all. So, and I'm only bringing that up because I think sometimes people might hear, oh, dogs get coronavirus, or there's vaccines for coronavirus in dogs. And that's true, but it's not the same. It's not even the same disease. It's a coronavirus. It's in the virus, that coronavirus family, but it's not even close to the same disease. But certainly with cats, we've seen, there was those reports at the Bronx Zoo that a tiger got it. There's been reports of other animals like minks that have been able to contract coronavirus from people and then incubate the virus and then pass it on. And certainly domestic cats are a concern. So someone who has a cat who gets the coronavirus might give it to their cat, and the cat might become sick and then also become a carrier later.
Okay, thank you. Just a note to those who have joined us since the beginning of the meeting, you can submit questions using the chat feature, and then at the end of the interview, I will select 2 or 3 audience submitted questions to ask Jim. So my next question is, what actions can governments take that will both protect animals and help to prevent future pandemics?
So governments can they can do multiple things from a policy perspective. So certainly banning wildlife trade or improving enforcement of wildlife protection and wildlife crime laws would go a long way towards stopping these interfaces. Because when you think about how these diseases get from wildlife or from animals into the human population, it's all about risk mitigation. So by reducing the interface, so the hunter or the value chain of how wild animals get from the forest into a market or into someone's home where they're using it as a protein source, by reducing the number of times that people come in contact with those animals, then obviously it's going to reduce the number of situations or events that might lead to a pandemic like the one we're experiencing right now. So that's one thing, is improving those laws and stopping wildlife trade generally. But that also takes it takes investment from the governments to invest in these things to keep people from, to prevent these things from happening. And then the other thing that people can do, that governments can do, is they can change the way they interact, change the policies to keep, to protect large areas of forest or large areas of wild places, so that the land use change doesn't lead to animals or wildlife being impacted by human industry. Because there's a link between a reduction in biodiversity and an increase in these events. So certainly areas like very biodiverse areas where there's a lot of tropical forest, those tropical forests kind of protect by being large contiguous forests. It protects people. It keeps the boundaries of those forests stable, so that they're not knocked down, and then it disrupts the whole ecosystem, which then leads to the potential increase in zoonotic disease spillover events. So those are 2 things that people could do. And then the other thing is, I think certainly changing the laws that affect animals, so animal welfare laws, and how animals are treated when they are used for food. So animals that are, thought of as a meat product or a protein source within an agricultural setting, if we improve the animal the way those animals are treated, reduce their stress, give them more space to live. Yes, it might make meat more expensive, but it's also going to improve the health of those animals because their living conditions will be better during the time that they're alive. And then that will also end up reducing negative health impacts of those animals while they're living in those conditions. And then also hopefully reduce the risk of disease spillover from domestic animals into humans.
So concerns have been raised in some quarters that measures to prevent future pandemics, especially closing down wildlife markets and bans on the wildlife trade, may harm people who are dependent on such practices for their subsistence or livelihood. Do you believe this is a serious concern? And if so, how would you respond to that?
I think there's a big difference between people who live near a forest or near, in a rural area near a forest, and then do subsistence hunting. So they go hunting to provide food for their family, versus going hunting and taking lots of animals, harvesting lots of wild animals from the forest to sell to markets in a big city. And so I don't have a problem. I think most people don't have a problem with people hunting, and if that's their main protein source, or places where people don't know how to raise animals very well because it's not part of their culture. And so part of the culture is to go hunting, to harvest animals from the forest so they can have it for food for their family. I don't think anyone's suggesting that people should not be allowed to do that. I think it wouldn't be right to stop people from doing that. But the problem is that in a lot of these situations, people are going out and hunting and they're just harvesting lots of wild animals for a larger market, whether it's a market in a big city in a place like Liberia, or even people who grow up in countries where eating bushmeat is normal, and then those people might move away to another country, and then they still, they like the taste of the food that they grew up with. So then wherever they're living, they might be living in Europe or the US or some other part of the world, and they still want to eat the same kind of, maybe they want to eat pangolin, right? They grew up eating pangolin and they still want to eat that. So they have that wild meat sent from wherever their home location is. And those are the things that we want to change. I think there certainly are other protein sources that people can eat. There's obviously a long history of raising animals for food. And so I think having alternatives for people is one thing, but I don't think anyone's suggesting that people shouldn't be able to, go hunting if there is no other alternative. But I think having alternatives for people is a better way to then protect the wildlife. Because the fact is, in a lot of places, especially in tropical forests, it's not the tropical forests they don't support a lot of wildlife. So if there's overhunting, it can wipe out whole species of animals, at least in local areas. And so I think that's something that we want to prevent, both to protect the animals, but also because it protects ecosystems. If you have too many animals removed from a particular ecosystem, then the ecosystem itself becomes unbalanced.
What can be done either on a governmental level or by NGOs or other organizations to provide alternatives so that people don't have to hunt for subsistence?
Well, I mean, there's a lot of programs, there's a lot of NGOs that work on this, these particular issues, but I think it takes long-term investment. There's a lot of projects or a lot of grants that only run for a set amount of years, and then it takes a long time for people to develop the habits and behaviors and learn about how to raise domestic animals. It's not natural for a lot of people. A lot of people don't grow up in that kind of that's part of the culture. In other places, it is part of the culture, and so it's very normal to raise animals for food. But in places like Liberia, it isn't normal. You know, people practice, you know, slash and burn agriculture historically, and they hunt. But now, as the population grows, Western governments that can, or NGOs or grant-making organizations need to invest, which they have been doing, but it needs to be done sort of, I think there needs to be a better overall approach and a longer term investment and then finding a way to get people to learn the skills that they need to do, and then slowly give them the chance to achieve success. And then when they start achieving success, then it can sustain itself. So trying to find a way to make it sustainable for people to raise other domestic animals for themselves, I think that's the best thing to do. Now, I'm not saying this isn't something that hasn't been tried before, because it has, but a lot of times what happens is it's a short-term thing, and then people it doesn't become a habit for people to raise animals correctly. And when they don't achieve success doing that, then, you know, then it won't perpetuate itself. And so that's one of the problems I've seen in the different places that I've worked.
Okay, so I'm going to take an audience submitted question now from Debbie Cox. How might a plant-based diet or lifestyle personally and globally impact the risk of zoonoses? And I'm going to riff on that slightly and add to it is, are plant-based food systems, plant-based agriculture, realistic alternatives for people who are currently dependent on hunting, as opposed to shifting toward still eating animals but farming them to produce food?
I mean, certainly, you know, if we look at the big picture, switching to an entirely plant-based food system for the world would be better for the planet and better for animals generally. But in places where, just like I said before, there's certain areas of the world where people aren't used to, or they don't have the right environment for growing a wide variety of crops that they would then be able to switch to and be able to get the right nutrition, you know? So again, I think that would take, like I said before, with alternative protein sources in terms of domestic animals as opposed to wildlife. I think that takes an investment, and it takes people learning how to do that. And the same thing goes for agriculture. It's, you know, not everyone knows how, like I myself, I'm not a farmer. I don't, you know, I could learn how to raise certain crops, but it would take me time to learn that and to be able to achieve success doing so. So again, it would take investment and then a plan to do that so that people could learn the right skills and then be able to sustainably do it over time.
All right. One more question. Actually, maybe more than one question, but this is also audience submitted from Catherine Makalaba. Apologies if I'm mispronouncing your name. She thanks you for the insightful interview and asks, are there some ways we can have more eyes on the ground to detect issues for both disease risk and animal welfare? How can communities or frontline health or conservation workers be part of the solution for reporting, enforcement, or otherwise?
That's a good question. So there's a whole new, there's a whole new concept in the public health world called One Health. And so if you take a sort of multidisciplinary approach within communities, so any community where you have health workers, so human health workers, animal health workers, and then say foresters or people who work within the environmental sector who deal with wildlife, if you have them meeting both at a national level, but also on a local level, you can train people, you can train community members to pay more attention or do recording of what's going on, so that if a problem arises and say, someone's chickens or someone's pigs or cows, or maybe someone who is in the forest collecting firewood and they notice some animals that are wild animals that are sick, they can then alert their local One Health team about what's going on, and then that can again go up the chain to on a national level, where people can then have the resources to go and respond. So I think there's a role to play. In Liberia, for example, there's a lot of community health workers, and they're starting to have more community animal health workers as well. And that's a model that's used here to be able to better, a lot of it's about being more observant, and then communication between these different sectors, whether it's animal health or the Ministry of Health and the Ministry of Agriculture, and then the wildlife sector, where people are communicating so that they're more aware of what's going on in these different areas, so they can better protect the health of each different sector.
All right. Are there any governments that you believe have done a commendable job so far in incorporating animal welfare or animal protection into their pandemic responses? And are there any that you think are falling especially short?
That's a tough question, because I don't know. I'm not sure. I'm not aware of the different animal welfare laws in different countries in terms of who might be doing the best job. I think certainly, we've seen from what's going on in China, the sort of wildlife trade business and industry that's going on there with wildlife farming, I think is not a good system. I think it's a bad system. I think it's bad for those animals' animal welfare. And then it creates huge potential problems where you have live animal markets with many different species of animals, whether domestic or wild animal species, near each other and under stress. I think certainly from a public health response perspective, certain countries that have experienced the risk of pandemics before, so countries like China or in Southeast Asia, they've had a good response to, once it's entered the human population, a good response on how to respond, because they've had to worry about it for a long time, especially with influenza. So they're aware of how quickly, avian influenza, how quickly it can go from birds and then into the human population and cause major problems. I think in other places, I think in the Western world, to be honest with you, the animal welfare, especially in the United States, the animal welfare laws are really terrible. There's no protection for animals that live in these factory farming situations, and so that potentially leads to potentially catastrophic situations if the right or wrong disease comes along and gets into those populations, because it'll just spread like wildfire. So I know that's not a great answer, because I wish I should know more about which countries have really great animal welfare laws where you can see these effects. But certainly we can see the countries that aren't doing a good job. And I would say, that the U.S. is one, and then China would be another in terms of in terms of wildlife and wildlife farming, and then the U.S. in terms of factory farming.
All right, thank you. I think that was a good answer. And unfortunately, that's all the time we have for today's interview, but we will continue, the Animal Issues Cluster will continue to host interviews throughout the high-level political forum, so this week through the following Thursday. And tomorrow's interview will be at 8:00 a.m. U.S. Eastern Time with Dr. Chinni Krishna, the founder of the Blue Cross of India, on the subject, creating safe and healthy communities through dog TNVR, that is trap, neuter, vaccinate, and return. Once again, thank you, Jim, for joining us today, and thank you to everyone who has signed in to participate.
Thank you so much for having me. It was nice. It was nice being part of this.
Absolutely. Thank you very much.
Okay. Bye.